What's new in 2023 for Transitional Care Management, or TCM? In this video, we'll discuss everything you need to know about the CPT codes for TCM so that you can properly bill and code for this program. Hey there, this is Lauren from ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for CMS programs like Transitional Care Management with our care coordination software. If you'd like a reference guide for the TCM CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. So, what are the 2023 updates for Transitional Care Management? There were no major changes to TCM rules and regulations in CMS's 2023 final rule, but good news is there is a substantial increase in the reimbursement rates for the CPT codes. We'll cover that in just a bit. Keep in mind that the codes are based on a national average, which may vary in your area. For the exact current rate based on your location, visit the Physician Fee Schedule website. TCM provides for patients in the first 30 days after a discharge. The goal is that the patient avoids readmission and has a successful transition home. If a patient is not readmitted after 30 days, and the 3 segments of TCM have been completed, including the interactive contact, the non-face-to-face services, and an office visit, billing can commence. There are 2 CPT codes for Transitional Care Management, and they are based on the complexity of medical decision-making. Only 1 code can be billed per patient per program based on that complexity. So, what exactly goes into determining the complexity in medical decision-making? Complexity can be determined by how many possible diagnoses and/or the amount of care management options needed to be considered, the complexity of medical records, tests, and other information that needs to be acquired and analyzed, or the risk of significant complications with the patient's conditions. It's ultimately up to the provider to determine the level of medical decision-making. At the provider's discretion, one of the following codes can be used for billing. The first is CPT code 99495 for moderate complexity in medical decision-making. The patient will need to be outreached within the first 48 hours of discharge, and the face-to-face office visit must occur within 14 days of discharge. The current national average reimbursement for a 99495 claim is $205. The other option is to bill for high complexity in medical decision-making with code 99496. The patient will still need to be outreached within the first 48 hours of discharge, but the face-to-face office visit will need to occur within 7 days. The national average reimbursement is about $278. One thing we didn't mention is low complexity in decision-making. For Transitional Care Management, you cannot bill for lower complexity. However, we at ThoroughCare strongly recommend you still complete a TCM for low complexity, but you cannot bill for them. Otherwise, you can bill for an E&M visit. Having completed a TCM will help make sure your patient has a smooth transition home and also add to the value-based offerings at your practice. So now that you have a better understanding of TCM and its CPT codes for this year, what should you do next? If you'd like to learn more, there's a link in the description below to our Learning Center, where you can read and learn more about TCM as well as other value-based programs. And don't forget to download your free reference guide for the billing codes we discussed in the video. Like we mentioned, they're pretty high in 2023. Please like and subscribe this video, and thank you for watching. We'll talk to you soon.